Good morning and good afternoon, everyone. My name is Ian Culbert. I am the Executive Director of the Canadian Public Health Association, and it is my pleasure to welcome you to today's webinar on a career in public health. Very quickly, a short commercial about CPHA. CPHA is the largest and oldest, most established independent public health organization in Canada. We currently have over 1,200 members, approximately half of which are students and trainees. If you aren't a member, I strongly encourage you to become a member today. Check out our website at www.cpha.ca for membership details. Because students are such an important part of our membership base, we've been listening to what you need from your public health association, and certainly being interested in a career and looking for mentorship and networking opportunities is something that the association is looking at developing in 2017. This webinar series is just part of that. So you're joining the webinar series about halfway through the series, and it has been extremely popular so far. For members, if you weren't able to participate in earlier webinars, they are recorded and available through the member portal, as will be today's. So for non-members, the webinars are all available at a cost of $12. So we're going to start today's webinar with a quick poll to see where everyone is joining us from. So if you want to click where you're from, we'll take a quick poll of the audience. Okay, so Ontario's leading the pack. Quebec. Some good representation from Quebec and a smattering from other parts of the country. Okay, great. Thank you very much. We're going to do another quick poll, is just to identify who is participating on today's webinar. So just click the category that best suits your category. Excellent. So another good cross section. So just a little bit of housekeeping about the webinar today. Sorry, one more poll. So asking if you're a member of CPHA or of the Public Health Physicians of Canada. Super. Excellent. Good to know that we've got some members and some potential new members. Everybody will be a member eventually if I have my way. So thanks for participating in those polls. So just some quick housekeeping about today's session. You'll note that all participants are muted so that we can manage the sound quality effectively. But if you have any questions, you can post them through the chat box. You can update your status or give hints to speakers throughout the course of the webinar using the tools to say speak louder or slower or softer. With the questions, we will do our best to answer all of your questions during the course of the webinar. The webinar is being recorded today, and the recording will be made accessible to all CPHA members and registered webinar participants shortly following today's webinar. We will make the slides and the recording more broadly available 3 months after today. At the end of today's webinar, you will be redirected to a short survey to give us your feedback about today's session. So we appreciate you taking a couple minutes to complete that at the end of the day. So with no further ado, I'm going to introduce today's presenters. Frank Welsh is CPHA's Director of Policy. He's responsible for all of the development of our policy alternatives and our advocacy work. More directly related to today's webinar, Frank also manages CPHA's Practicum Placement program. And the second presenter is Shannon Leblanc. She is an epidemiology officer with the Department of Health and Social Services in the Northwest Territories. Shannon is a recent MPH graduate, so there you go. Just goes to prove you can get a job with an MPH. So thank you very much for joining us, and I will now turn it over to Frank.
Thank you, Ian. Good morning to all the folks out in the West, and good afternoon to all those here in the East. Thank you all for attending. I'm looking forward to talking to you about what I look for as we go around trying to find practicum placement students to meet our needs. And the reason I'm here is really CPHA relies very heavily on practicums to do a lot of our basic work around policy development, helping to develop advocacy strategies, and the like. Every term we try and get 2 to 3 practicum students within. Some terms we're more successful than others. Normally you'd find if you're coming out to look for a position for fall term, you have greater likelihood of success. If you get into winter term, we have higher levels of people coming to join us. And also in the spring and summer, it's a fairly competitive process. The question is, what makes you a good candidate for us? So we'll talk a bit about that, and then we'll talk a bit about what I can do for you. So I'm looking for an X factor. That's what I'm looking for, because you're all coming out with good skill sets on a number of issues. You can see a series of questions that will lead us through today. So what do I mean by an X factor? It's that something that says, I really want to work with you, and allows you to, and I'm willing to become part of your team for the 12 or 14 weeks that you're with me. So how do you convince me that you have the X factor? So next slide. It really starts very early in the process, and it's about that placement posting you'll find from our facilities that'll say, here's the options we have. Right now, or coming into this term, we had 2. One for a general policy piece and another one for some work on kids' play. What I'm looking for you to do is tell me why you fit within the organization. It doesn't have to be a direct fit. It can be simply based on energy and excitement or interest in the topic. It's how do you align your interests with what we're doing, and how do we make that fit, or whether we can make the fit. And also, when you read the posting, please respond to the issues we raise in it. It makes our life easier. Now, there are requirements we have laid out, but like I mentioned, we're looking for an X factor. And let me tell you about a conversation I had with a placement officer at Google one time. He said, there are lots of people out there with great skill sets, and they all are looking for appropriate jobs. For Google, they have to have the Google mentality. For CPHA, it's you have to have a CPHA mentality. What that is really gets down to enthusiasm, interest in the subject areas, willingness to do a very broad range of activities. But we'll talk a little bit more about that in a couple of minutes. The second part after that placement really gets down to the issues of your letter and CV. Let's make sure there's a crosswalk between what we're asking you to do on the placement and what's contained in the letter and the CV. Be clear, present your case. Really, you want to show that you care enough that you've done your homework on the organization, looked at our website, perhaps looked at some of our documents that we produced, and be able to talk about that, because eventually we may be calling you to come in and do an interview. And it'll usually be on the phone, about a half hour long. When you come into that interview, please be prepared. Know what you're talking about. Know what the subject matter of the 2 posters are. Be ready to ask questions, because those questions really tell us that you're interested in our job. And it says you've taken the time to find out about the culture of the organizations, and that you've taken time to find out about the subject matter. To us, that speaks a lot to your interest in coming forward and doing working for us for this short period of time. Now, I've got to tell you, every interview starts with the same question. I always ask this question, and I think almost anyone who's looking for a practicum will have some version of this question during the interview. That first question is, I've read your CV. Now tell me about yourself. And what I'm asking there is, how do the two pieces fit together? What are your interests? What makes you have that CPHA mentality that says, I need to bring you on and spend my time coaching you to learn good things? So we've come through this process, and you get the note from Karen, our office manager, saying, how would you like to come on board? And you've said, yes, I want to come on board. What can you expect? What do you need to bring into this office when you come on board to be a real success here? I think there's some very interesting pieces. And it doesn't speak to your skill sets, because your skill sets are in development. We'll help you develop those skill sets. But what we're looking for are your interest, your willingness to do a number of different activities, and your willingness to be part of our team and to meld within our team. And that brings up another conversation I had several years ago now, where the question about Watson came up. We all know who Watson is, I hope. IBM developed a supercomputer that won at Jeopardy called Watson. The project manager for IBM stopped and was asked one question, and that was, what is the toughest thing about developing Watson? Wasn't the coding. It wasn't the technical aspects. It was the people. And the trick is to find the people who will fit within your organization and work in unusual circumstances or with unusual partners to address an issue. Now, I'm not asking you to do that on a large scale, but what I want you to do is bring that attitude within our organization and be prepared to do a lot of different things. So, and you will get a chance to do a lot of different things. And as we go through at the end, we'll talk a little bit about what we do here at CPHA specifically. So with that, what should your expectations be coming into a place like CPHA? I think there are probably 3 or 4 different core elements you should expect coming into a practicum placement. And it's really the flip side of the coin from what I just talked about. It's, you should be given the opportunity to do many different things at various levels of expertise amongst your skill set. I keep telling folks, and actually I go back to when I was doing my PhD, and the first thing my supervisor told me was that a PhD is one project. You're going to have many projects in your lifespan, and you'll have a varied career. That goes the same for you all who are coming into practicums or who are coming out with your master's degree. That first piece, that practicum placement, is only one action, one activity, and you should be able to do many different things, because after all, you're building a skill set that becomes transferable. You should also be given the opportunity to both fail and improve. And definitely, you will fail while you're here. I can guarantee it. I have not had one student who has come in and wowed me full time. But what we'll do is build on that and strengthen it and find those skills and help you develop them. After all, failing is not a bad thing. It's a way of learning. And you should expect to learn while you're on a practicum placement. I will also give you tons of feedback, and you should expect feedback. And that feedback is both everything from the esoteric of how policy and government works through to how to write a brief. Because when you come to CPHA, that's what you learn. And finally, you should be getting some very significant impact or insight into how organization works and how you have to develop and mold within an organization and with partners and stakeholders. Those should be some of your expectations coming in. So with that, let me just shift a little bit and talk about CPHA as a case study and what we're trying to accomplish and what you should expect if you come here. I can tell you that I read every letter and CV that's sent to me, and that's because I'm interested in you all, and I want to find out your skill sets, and I want to get the best people possible into this organization. And that means you have to tell me your story cleanly and concisely. And you will have an interview if you make that first cut. In that interview, I'm looking for your enthusiasm. I'm looking for your willingness to come forward and talk about who you are and what your aspirations are. And if I ask you a question and you don't know the answer, don't try to bluff me, okay? Be very straightforward. Tell me don't know, but tell me how you will learn to know and how you will approach that issue. Then when you get here, if you get offered an assignment and you come in here, be ready to have your work torn apart because you're coming from an academic milieu into very much working milieu, and we'll teach you how to write that two-pager that allows you to sell your piece very quickly and easily to your bosses, to your managers, a very transferable skill set. We'll talk about how policy is made and how politics plays into policy. We'll talk about project organization and development and really look at what your skill sets are and how to improve that skill set within the work stream of CPHA. So what are some of the hot topics? E-cigarettes, cannabis, children's issues, poverty reduction, and almost any flavor of the day coming forward. So I'm getting this look from our convener saying I should end up fairly quickly and you can get on to your next presenter. So as some final thoughts, let's say practicum placements are win-wins. You get to come in an organization, find out how we work, learn some skill set, expands your skills, and we get a willing, eager person who is here to help us make the next step, address the next issue. But in coming in, don't expect to learn the world. Have reasonable expectations and realize you're working for an organization. So you have to work within and for that group of people. But make sure everything is a learning for both you and the organization. And in the end, enjoy your practicum, be enthusiastic. And as Ben and Jerry's, the ice cream guys, once said, if it ain't fun, why do it? So let's have some fun while we're working together. Thanks.
Thank you so much, Frank. That was a great presentation. And we'll turn things over to Shannon now. And then we will have some questions, but please do feel free to type your comments and questions starting now in the chat box.
Hello everyone. Thank you for tuning in for today's webinar. I'm glad to be sharing my practicum experience with you. Today I'm going to talk to you about how I chose my practicum, what I did during my practicum, and some tips that will hopefully help you during this process of choosing your practicum placement. So right now I want to do a quick poll to ask you guys how you apply for your practicum placements. Okay, here we go. I know that across Canada there are different MPH programs. The way that MPH programs approach this process is different. I was fortunate enough to be in a program where we had a practicum coordinator who found practicum placements for us. So depending on where you fall, your strategy to finding a practicum placement might differ. But I'm going to highlight how I approached my practicum search, and I believe the strategies I took will help you in both situations. So I see here that most people have to search for their own practicum placements. Now, hopefully, the way that I approach my practicum placement will help you during your search as well. Okay, so some of what I'm going to talk about is going to be very similar to what Frank was saying, so some will feel like an iteration, but it's very important, I feel. So when choosing my practicum placement, there was a series of questions that I asked myself. I began by starting to ask myself what goals I wanted to set for my practicum placement. It was at this stage when I assessed my current resume and identified skills that I needed to or wanted to improve on. When reviewing my resume, I realized that prior to my master's, I had very little healthcare experience. I did and had a bachelor's of science in mathematics and statistics and did research in repetitive strain injuries. After graduation from undergrad, I decided to do my master's in public health because I wanted to pursue a career in epidemiology. Since I had already had an analytical background, I figured I needed to learn more about public health in general and decided to do my MPH. So when it came time to choose my practicum placement, I figured it would be the perfect opportunity for me to bridge my new knowledge and understanding of public health with my prior education in math and statistics. Another series of questions that I asked myself when selecting my practicum was, what am I interested in? Am I looking for experience in the private sector or the public sector? And at this point in time, I had no prior experience in the public sector and thought it would be a good opportunity to see what it was like to work in government. I also asked myself if I was interested in rural versus urban setting placements. I had grown up in a small community of about 1,200 people, and I had always had an interest in rural public health, and thus placements with an emphasis on rural public health were more interesting to me, and those in bigger cities like Toronto were very scary. Lastly, when thinking about my placements, I was looking at I'm more interested in primary care, public health, global health, environmental health, health promotion, and the list goes on. As I am sure you have learned, there are several areas in public health, and if during your master's you really enjoyed one particular area, perhaps you would like to spend more time on this topic. On the other hand, your practicum placement is also a perfect opportunity to try something new. Feel free to step out of your comfort zone and take a step out on a limb. These are just some of the questions that really helped me narrow down my practicum search because at first it seemed like there was an endless list of practicums available. So just a brief overview of what my practicum placement was. I did my master's in London, Ontario, and moved to Yellowknife in the Northwest Territories in May. When I arrived here, I was able to walk out on the ice, and I was putting up dark curtains in my bedrooms to block out all the sunlight. I worked for the Population Health Division in the Department of Health and Social Services with the Government of the Northwest Territories. The placement was unpaid. However, they felt bad that I was working so hard for free, and within 3 weeks, I received a job offer. I was working for a preceptor who was the territorial epidemiologist, which I thought was perfect. Since I was wanting to pursue a career as an epidemiologist, I had the opportunity to learn from somebody firsthand what it was like. The projects that I was working on for my practicum placement were an immunization coverage analysis for the territory and an audit of the existing NWT immunization registry. While I was with the Department of Health, because there was such a small organization, I had the opportunity to collaborate with communicable disease consultants in charge of the immunization program for the NWT, and I had the opportunity to sit on the Northwest Territories Advisory Committee on Immunizations to get the first chance to hear from nurses in some of the higher Arctic communities on how they deal with people in the communities and how immunizations are actually administered in the field. I also had the opportunity to work on other projects such as Flu Watch and the social services incidents report. So for my practicum placement, I had several deliverables, and I'm sure everyone else will have different deliverables, but the deliverables for Western were a poster presentation that was done at the end of our term. And we also, my poster presentation was also turned into one for my organization that will be presented next week at the Canadian Immunization Conference. My university also required us to complete a teaching case based on our practicum placement, and my teaching case had 4 objectives that were based on epidemiology. They were to recognize the challenges that arise when dealing with data in remote northern communities, understanding the importance of data quality, interpreting immunization coverage data, and indicate the benefits of implementing a new information system to support the existing immunization registry in the Northwest Territories. Here is an example of the deliverables that the organization had for us, because I had 2 deliverables for my university, the poster along with my teaching case, and then I also had 2 deliverables for my organization. One was to produce a report on the immunization coverage analysis, and one was to produce a report on the audit of the immunization registry based on just one cohort of children. And this here is just the first page of both of those reports. So it's important to note that your work is not just for your master's program, it's also for the organization, and you're contributing to their organization. But another really important thing to consider about your time at the organization is that your practicum placement is not only about the project you are assigned to do at your organization. It is about the overall experience. For me, it was about learning about a new culture, a new way of life, new traditions, food, customs, language, values, disease, healthcare, education, and economy, the history, and the list just goes on. Everything affects their health. It's not just about the project that you are assigned to do. Yet I was immersed in a new culture, a new place, and I wanted to learn about everything and how it was affecting the data that I was receiving in my position. But the point I'm trying to make is that in order to really succeed with your practicum placement, you need to embrace yourself and your surroundings. One needs to have a better understanding and appreciation for their surroundings before you can provide any recommendations for your practicum placement. The last thing I would like to conclude with is by reminding you that your practicum is not a stepping stone to a job, but rather a means to vamp up your resume and learn for your future. Thank you for listening to my tips for finding your perfect practicum placement, and I'm here to answer any questions.
Terrific. Thank you so much, Shannon. I see that we do have a couple of questions already, so we can address those questions now. Please type in other questions, and then after we address these 2 questions that are posted, I'm going to just briefly show a few tips that came in from other universities. But first, there's a question from Christy Barron. Her question was for Frank. She's wondering if all CPHA practicums are in one office in Ontario, or are there options across the country for distance placements?
Hi, Christy. I prefer to have our practicum placements based here in our national office in Ottawa. If you're coming in from outside, it gives you the opportunity to understand what Ottawa is about as a city, change of venue. More importantly, by having you here, you get the benefit of interacting on a regular basis with routine feedback on the work you're doing. It also allows you the opportunity to interact with the other practicum placements that will likely be here, and also with the staff in the office, so that you get a better sense of what an NGO like CPHA runs across on a day-to-day basis. So that being said, I have managed practicum placements outside of the national capital area, and it just changes the dynamic of how we have to work, and it can be done.
Thank you. Judy is wondering if you could repeat the hot topics that are being addressed by CPHA.
Okay, CPHA currently has three main streams of activity. One is around environment, health in the environment. The second one is around children's issues. And the third piece I've been calling mental health and addictions, but it really focuses more on use of illegal psychoactive substances, tobacco, alcohol, that stream of activity. So hot topics right now that we're actively engaged on are e-cigarettes, developing a position statement and positioning ourselves for the consultation around the legislation on e-cigarettes and plain packaging of cigarettes. The second one is we've taken a very active viewpoint or role in talking about legislation and regulation of cannabis, and will have continuing activity in that area over the coming 2 or 3 years as we go through the legislative development and regulatory development. Children's issues are really on 2 or 3 different areas. One is the notion of active outdoor unstructured play for kids, otherwise known as risky play, where we're developing a policy framework. We're also actively engaged on early childhood education and care issues, and we'll be setting up an advocacy strategy and doing some work around that. There's also the issue of flavor of the day, which can take you off on sidetracks once in a while. Over the last year, our flavors of the day have ranged from antimicrobial resistance and the proposed regulations around that, to homelessness and housing, which actually is going to become a much bigger issue for us as we start talking about the role of poverty reduction from a public health perspective. So I guess those are a very high-level run of the kinds of things we're doing.
Terrific. Thank you so much. I see a few other questions have come in, and we will get to those. We invited all of the universities with schools of public health in Canada to send us a few tips for that they would like to give to the participants in today's webinar about how to find a practicum placement. So I'm going to have these slides on a bit of a rolling loop so that you can read them at your own time, but also be advised that you will be receiving these slides following the webinar, so you'll get a copy of your own. So you'll see each slide there lists the university that provided the tips. And I think that both of our presenters, Frank and Shannon, really picked up on a lot of these points in their own presentations. So a couple of other questions came through. We had a question whether someone is taking their MPH in the US but they are residing in Canada. So can they be expected to find a practicum in Canada?
From a CPHA perspective, we would look at your skills and competencies, your CV, look at the more esoteric pieces, the fit, and other related considerations that I talked about a little earlier. And if they measured up and we were comfortable that there was some common ground for us to work on, sure, I didn't see a problem with working with a US university.
Okay, great. We also had a question whether students need to pass the public services exams to work at CPHA?
CPHA is a not-for-profit, non-governmental organization, so there's absolutely no need for that public service exam, which we all hate.
Okay.
I used to be in the public service, so yeah, I can sympathize.
Someone is asking whether Aboriginal health and refugee issues are priorities with CPHA.
Okay, first, from Indigenous populations, they are absolutely a priority with CPHA. If you followed our conferences for the past several years, you've been seeing an increasing presence of Indigenous populations issues. We've also come out strongly on missing and murdered Aboriginal women, sex work, which is highly dominated by Indigenous women, and other related topics. Where you may not see us as a leader in the area is because we've taken the position that we're there to support those Aboriginal or Indigenous peoples' organizations where we can, as they're the ones with the lived experience, know the issues much better than we do, and can advance their own methodologies and approaches for responding to it. So coming in, our attitude is that we're here to support and help where we can. In terms of refugee issues, we deliberately looked at what CPHA could accomplish versus what other very practical organizations in that sphere are accomplishing. And again, we have agreed that it's a major issue with significant problems that affect the Canadian system, but there are organizations better positioned to address those issues directly, and as a result, we're there in support again.
Okay, great, thanks. We have a question for Shannon. And Shannon, you mentioned that after 3 weeks into your placement, you were offered a job. So in other words, you started out working as a volunteer practicum placement, and then this turned into a job. Was that common among your classmates?
Okay, I just had to figure out how to unmute myself, sorry. I don't think it was common among my classmates, but because the cost of living was so high here in the Northwest Territories, my supervisor felt very bad that I was working as a volunteer. She didn't, especially where I was still paying tuition. So she went out of her way to find some additional funding so that my position could be a funded position at that time. And I think that was very unique in my situation. I was not aware of any of my classmates who started in an unpaid position and ended up getting paid throughout their term.
Great, thank you so much. We have another question here from Sabrina, wondering if there's a preference for students in MPH programs or other master's programs, for example, health evaluation.
Really good question. We tend to take more of the NPH students because most of the universities have a required practicum placement requirement built into that program. So there's a steady stream of volunteers, can I call you that? However, we have worked with University of Saskatchewan, their master's program, which is not a public health program, but brought in people from that program, also 2 or 3 other programs around. At times, we'll also take in sort of 4th-year students who are well-positioned from health services types of programs. So for us, it's what are the skills needed? Will your skills contribute to us, and can we help you in developing your skills? And is there a commonality that we can build on? So The short answer is no, we aren't restricted to MPHs. They just happen to have that requirement built into their programs and be relatively easy to access for us.
Great. So we have two questions that I think could probably be addressed together since they're somewhat similar. So one is for someone whose interest is in antibiotic resistance, do you have any insights as to where they could find a practicum opportunity in that area? And similarly, someone doing work on hand washing and hygiene, are we involved in this area still?
Yeah. Okay, antimicrobial resistance. I know our colleagues at Canadian Vet Med Association have been very active in the area. There is work going on through Healthcare Canada.
National Collaborating Center.
There's also National
for Infectious Diseases is doing quite a bit of work in that area.
Yeah. As well, our colleagues at CPHA and at Public Health Agency of Canada are both, well, they're leading that regulatory development, so they'll be very engaged and may have interest in a practicum placement in that area. In terms of hand washing, not within the CPHA context per se, but again, that is probably more related to infectious disease and flu and that area of expertise. And the lead organizations in those areas are once again Public Health Agency of Canada through their infectious disease directorate. I'm just going through the mental list of organizations. They would likely be the one you would most likely have success with.
Mm-hmm. Yeah, CPHA certainly did have a global and international health branch, but we've had to scale that back. Mm-hmm. So I think maybe Shannon can answer this next question that we have from Jacqueline. She's wondering if you are setting up your own practicum at an organization that may have never hosted students before. Do you have any tips?
So if you're searching for your own practicum, I know when I was going through my practicum search as well, I was really interested in looking for practicum placements in the Maritimes, since that is where I am from. So I was working with my practicum coordinator, and if you provide if you have connections in some locations and you start communicating with some organizations, like whether it be public health units or cancer care centers, diabetes association, or different things like that you're interested in a certain spot, and you can ask them if they've ever hosted, and if they haven't, you just have to provide them with information regarding what hosting your practicum placement is like, what it entails, and tell them why you're interested in working at their location, and then just communicate that with your practicum coordinator and connect the two, and you should be able to come up with, hopefully, if they are interested, you should be able to come up with a placement for yourself there. It is challenging to find placements in smaller areas if you're just looking for to look for a position in one community or something like that. But if you have a broader area that you're looking for, all you have to do is start communicating and getting some names back to your practicum placements.
Thanks so much, Shannon. Just a follow-up question came up from Veronica. when Frank responded to her question about working with Aboriginal peoples. She's wondering, does that mean CPHA can facilitate members in working with Aboriginal groups?
That's a good question. Largely, if you're looking at doing a practicum placement, you enter into a form of employment or an employee-employer type of relationship. And as a result, each organization will have their own processes for dealing with that. What we know is that we work with several different organizations, some of which are more developed to address public health issues, and that it's probably best to reach out to them directly. And the organizations that we often end up working with, either directly or indirectly, are groups like AFN, Aboriginal AFN, ITK, Native Women's Association of Canada. Whether they're interested in bringing in practicums or not is another question, and that's really something that has to be raised with that organization directly.
Okay, thanks. Thanks also to Ruth Wolf for adding a tip there in response to Jacqueline's question. She was saying it's important that the host organization have someone with the expertise in the areas in which you want to grow. So if you want to gain experience with evaluation, you want to learn from an evaluator. Sarah is wondering if we could discuss the balance between paid and unpaid practicum opportunities in Canada. Does this possibly represent an inequity for students, and is CPHA dialoguing about that?
I actually have no statistics available on number of paid versus unpaid practicums. I know that CPHA, that issue gets a little bit clouded because certain universities have funding available to cover those students who are entering into unpaid practicums. And it's pretty hard to tease out all that information because it addresses budgets and those types of questions within the schools themselves. Here, unfortunately, at CPHA, all our practicums are unpaid. However, there are students who come in and get funding through their universities to help them cover their expenses while here. Sorry, I couldn't be more detailed about that.
Okay, and there's also a question regarding the areas within environmental health that we're working on here at CPHA.
Yeah, that's again a really good question. There are a couple of things we can point to very quickly. We're undertaking advocacy around coal-fired power plants with a consortium of other organizations. Have also been very vocal on the issue of asbestos. You'll also find going through our discussion documents that a year in 2014, a theme of CPHA's conference was around the release of our public health approaches to the ecological determinants of health. So there are the immediate advocacy pieces that could probably stand some additional work. And then underneath that are a number of other issues that are still very much in the early developmental phase. And it's very difficult to say where they'll go. But that being said, we can probably find some fairly interesting work for you to do if that really is the issue you want to take as the core piece of your work.
Okay, an interesting question has just come up, and it's concerning opportunities for recent graduates. So certainly practicum opportunities tend to be reserved for current students. So what volunteer opportunities might be available for recent graduates?
I'm almost wanting to look over at Emma as she coordinates her volunteers here in CPHA, but we definitely have space for volunteers and tend to focus on specific projects and development. But I'll turn it over to Emma.
Okay, thanks. Yeah, so we are approached very regularly by individuals who are interested in volunteering with us, and certainly we are happy to have extra assistance on a lot of our projects. When it comes to volunteers, you know, we don't want to take advantage or take for granted the amount of time that you may or may not have to work on projects. So therefore, we wouldn't assign any time-sensitive projects. Everything would be very flexible, but it would be an opportunity for you to, we would identify a project that aligns with your skills and expertise, and that also aligns with our own priorities here. Examples, a few students who I've worked, or recent graduates that I've worked with in the past year, helped with some analysis of our membership data, and all the way from that to developing a membership campaign. So quite varied. We also had some volunteers doing some advocacy work, and right now I have a group of interested students and recent graduates who are interested in helping out with some social media. So if you are interested, please do contact us, and we'll try and set something up. So I think there might be, okay, I have a couple more questions have come in. So could you talk a little bit more about the work we're doing in infectious diseases?
Mm-hmm. Okay. Where to start on that topic? Because we have been very vocal around the issue of antimicrobial resistance. We're also doing some initial work on vaccine hesitancy, largely in partnership with a group called Immunize Canada, who are actually housed within CPHA, but have the lead on the majority of the issues related to immunization. That being said, we're not afraid to jump in when we feel there's an appropriate window opening up to us. So we have reached a point where a good amount of work has been done. Immunize Canada has their areas up and running and moving along, and they would be looking at perhaps some work in that factory or under specific areas. Within our own organization, I have a sense there are things starting to change, particularly over the next couple of months as we see about project work coming available. So I can't really tell you a lot about that until we know whether we're going to be funded or not and which direction that work will go. Sorry.
Great. Okay, thank you. So yes, Jacqueline, absolutely. Volunteers can help from anywhere in the country. All of our volunteer work is done remotely for the most part. And it's done on your own time. Some volunteers do have full-time jobs. So we work around your schedules and locations. So I think that most of your questions have been, we've responded to most of your questions. If you do have any other follow-up questions, feel free to send us an email. We would be happy to hear from you. I just wanted to go over a few more things before we conclude the webinar. So registration is now open for our next webinar, which is happening on January 4th. And the topic is public health careers outside of the public health sector. So I think that one theme that we've been hearing over the course of the webinars is that it's unrealistic to expect that just because you are graduating with a degree in public health, you may not necessarily get a job or even be interested in a job in the public health sector. So the presenters for the webinar in January, Annie Duchesne and Haitham Kosa, both have MPHs, but they are working outside of the public health sector. So that should be an interesting session indeed. Just to let everyone know that our annual conference is scheduled for June 6th to the 8th in Halifax. And it's a fantastic networking opportunity for students, as well as an opportunity to perhaps even find a mentor to guide you in your career. And if you submitted an abstract as a student, you can be considered for a $1,000 award. So the deadline for abstracts already passed earlier this week, and you should be notified by late January. I think that Frank mentioned a lot of the work that we've recently published here at CPHA, so I won't spend too much time highlighting this, but these are just some covers of our recent reports and position statements and advocacy work that we're doing on various topics. Finally, I've listed a few key contacts here. I'm Emma, and we do have a student director, Monsi, who sits on CPHA's board of directors, and she is an undergraduate student at McMaster, and she leads the Student Early Careers Committee. They're always looking for new members, so definitely please send us an email or get in touch with us if you have any more questions following today's webinar. So thank you all for your time. The presentations were excellent and you sparked great discussion. Your questions were very thoughtful, and I'm glad that we had the chance to respond to all of them. Have a great day. You'll now be directed to a brief evaluation. Please do take a